I'm pretty excited for today's topic because it's an important topic. In fact, I think it might be one of the most important videos that I ever make on this channel. And it has to do with how childhood adverse experiences, such as abuse and neglect, have a direct correlation to adults with chronic diseases such as cancer, diabetes, high cholesterol, and eventually a shortened lifespan because, indirectly, oftentimes because of childhood adversity. If you're new to my channel, my name is Tracy, and I'm a licensed psychotherapist in private practice with a particular focus and specialty in trauma and dissociation, anxiety, and depression. So let's talk about it. So back in the 90s, there was a doctor named Dr. Felitti, and he ran an obesity program for adults. So obesity was the topic for that group. And what he started to find was that there was majority of those patients had experienced childhood sexual trauma in their past, in their childhood. And they turned to food as a way to comfort self and perhaps to fill a void within stemming from the sexual trauma. So from there, the Center of Disease Control, so the CDC and Kaiser, developed a research project to see, does childhood traumas in a variety of ways that it can show up have a direct correlation to medical and health issues in adulthood? So they took 17,000 participants, and there are 10 questions. It's called the ACE assessment, which is Adverse Childhood Experiences. So it's an acronym. And on those 10 questions, you'll find questions such as, when you were growing up, did you ever feel unloved or unprotected? Did you have a parent with mental health issues? Did you have a parent or caregiver with substance abuse issues or incarceration? Was there physical abuse? Did you witness or the recipient of violence or sexual trauma or neglect? So those are the areas that the assessment asks questions about. And the more boxes you check off on the 10 questions, the higher the risk and the direct correlation to medical issues that your body is being set up for, and eventually a shorter lifespan. So that is really eye-opening. And a majority of my clients that I work with have complex PTSD stemming from those types of experiences. So complex PTSD is where you have chronic and consistent abuse and neglect experiences in your formative years, so prior to the age of 18. And so majority of my clients with PTSD, and particularly complex PTSD, have a range of health issues. And autoimmune diseases are running rampant. And they're finding that stress and unprocessed trauma is the root of a lot of these conditions. So if this is interesting to you, you can look into Gabor Mate. He's a Hungarian psychiatrist. He talks a lot about how stuck in unprocessed trauma and the emotions linked to those experiences are stuck, and that directly leads to medical conditions. So Gabor Mate, Bessel van der Kolk, he wrote The Body Keeps the Score, because the body really does keep the score. You know, our bodies are a recording for all of our experiences, whether we remember them or not. So we can have two types of memories. So implicit versus explicit. Implicit is just simply the individual was so young that they don't have the developmental capability to narrate what happened. So they don't have the skills yet to talk about what happened. So for example, a 2-year-old that was abused will only sort of, for the most part, remember it in the body, right? So the body gets triggered and has reactions. Explicit memory is just simply where the individual does recall consciously the facts of what happened, and they can talk about it, or they at least have the language to be able to explain what happened. So those are the differences. And so even though somebody has implicit memory only for some traumas, we can still target them with special treatments such as EMDR therapy or any somatic. Soma is body, so somatic therapy has to do with the body. So it's a bottoms up approach, and it helps individuals to regulate their nervous system and to process unprocessed memories in their body. So yes, you have to pay attention to what are your medical conditions and look at your childhood. What happened in your childhood that's unprocessed? Do you carry the wounds of things that happened? You know, what's fascinating about this topic is, so like I said, I work with a lot of folks with complex PTSD, and it is not uncommon that they have conditions such as fibromyalgia, which is a horrible condition to have. That's basically where chronic and consistent stress is building in the body, and it doesn't have anywhere to go necessarily because the person's not managing it, and it develops into chronic pain, and the pain is horrible, so painful that sometimes clients who have that can't even get out of bed, can't even shower. It's so painful. So fibromyalgia, Crohn's disease, POTS, PANDAS, chronic fatigue, which is another big one, premenstrual dysphoric disorder, which is PMDD, which with that one, or a lot of these, actually, what I find when I'm doing EMDR with clients over a period of time and we're processing the traumas that happened in their childhood, over time, what they start to report is at the time of their monthly cycle, they're not experiencing the amount of like insane symptoms that go with PMDD. So rage, irritability, the cramps, all of that starts to diminish over time with their monthly cycle. So there's something going on there, right? When you start to heal the body, your medical conditions can improve. I'll give you another example. Her name is, I think it's Anita Morajani. I think she's an Indian woman. Her case made not just national, but it made world news because she, in her culture, you know, it's children are to be seen and not heard. So, and as a woman, she grew up not having a voice. So what we call those they're fawners, for example. If you look at the 4 F's of stress responses, fight, flight, freeze, and fawn. A fawner, for example, will not speak up and be assertive. They won't disagree with others. They're the people pleasers. They do what others expect of them because they fear the consequence, or if in their culture that is just the way that it is, that's how they grew up. But what happens is you're not being authentic. You're going against what you want to do, and what happens is they're swallowing all of those emotions in their physical body, and over time what can happen is you develop some medical issues. And in her case, she developed cancer. And her cancer, she was on the brink of death. She was so far at the tail end of her journey. She had a near-death experience at the end of that. So I don't know if the spiritual stuff freaks people out, but this is an important story. When she crossed over to the other side, she learned the reason for her cancer. Now, you can call it spirits, God, whatever you want, but she got the knowledge that her suppressing all of her emotions and not being her authentic self and doing in life what she wanted and craved to do was causing strain and stress, and that turned into cancer. And the reason why her case was groundbreaking is because when she came back from having that near-death experience on the other side, her cancer, her tumors shrunk and were eliminated. And she travels all around the world now speaking about this, and I can assure you she now lives her authentic self. And there are lessons in that story. You know, we have to take care of ourselves. So there are a lot of treatments out there that can help you heal your physical body. So EMDR is classic. That is one of the gold standard treatments for folks with unprocessed traumas, somatic experiencing, so any type of body-based treatment, like I said earlier, somatic. So that helps to calm the sympathetic arousal state, right? If we're living in that state of sympathetic arousal, so what would that look like? Somebody who's in heightened stress, anxious, racing thoughts, anxiety, panic, paranoia, they're in that heightened state, which that's not good. You know, we have a stress hormone called cortisol, which is designed to help us, you know, if we're being attacked by a rabid dog, for example, our adrenaline will kick in so we can exit, we can run away, hopefully, right? That's the whole goal. But it is not designed to be activated all the time. If someone's in that heightened state, they have some serious stressors going on in their life. And if you compound that with adverse experiences in their childhood that are not healed, right? That just fuels it. So you want to do things like calming the vagus nerve, which is the longest running nerve in the body. Maybe going for Reiki sessions where they can help clear some of that stuck energy, or polarity therapy. You know, so any body-based treatment is really, really good. So I do want to talk about one other piece that is just fascinating to me. So I did a recent training. It's with EMDR. And the title of the training was EMDR and Resetting the Affective Circuits for Folks with Autoimmune Disorders and Conditions. So what's autoimmune disorders? Things such as Crohn's, multiple sclerosis, POTS, PANDAS, Sjögren's disease. There's I think over 100 different types of autoimmune disorders. And really, what's an autoimmune disorder? It gets put in that category when the doctors can't figure out what's causing all these symptoms. So it's often linked to stress, and that becomes autoimmune. Lyme disease is another one. There's so many. But this particular training resets the affective circuits. And it sounds like it would be a complicated protocol training with that title, but it's really not. So if you can find a practitioner who's trained and has a lot of experience working with EMDR therapy, and you're struggling with one of these autoimmune inflammatory, it's an inflammation issue, there's a protocol to reset the circuits. And I've been starting to use it with some of my clients, and I'm seeing results in a flare-up. So if they're coming in for a session and they're having a flare-up, like I had a case not too long ago, pain, right? They're feeling the pain in a certain part of the body. We follow the protocol with the EMDR, and by the end of that session, the pain was gone. Now, that's the implications of this training, I think, are groundbreaking, because what they're doing is they're taking mental health and medical and they're combining it, right? So it's a whole body issue. And we know that because, for example, so I'm in private practice, and majority of my clients, to pay for their sessions, they use their health insurance. So in order for me to take on that client, they have to meet medical necessity. But I'm a licensed psychotherapist, right? I work in psychology. So what does that tell you? That they see mental health as a component that feeds and fuels medical issues. So that's how important it is. And if they keep developing more protocols and treatments, where are we going to be in 20 years from now? That's going to be amazing. So if you're listening to this video, maybe you're in your 20s, or maybe you're in your 60s or 70s. It's never too late to start to work on yourself. But if you are in your 20s or your 30s, you are at an advantage, because it takes years, usually years, to develop medical issues as a result of trauma and stress. So you want to get ahead of the curve. You want to get ahead of the game and really start to implement even micro habits throughout your day. Deep breathing, where your exhale is longer than your inhale. That does wonders. That sends messages to the brain that it's safe to restore and reset your nervous system. So I love doing micro habits, stretches, self-tapping, where you tap nice and slow, and at the same time think about a pleasant experience. Maybe thinking about being at the beach on a warm summer day, where you can hear the waves of the ocean and feel the sun beating down in your skin. So that's a positive resource, where we think about something peaceful or relaxing, and think about that while you're slowly self-tapping. That instantly can calm your physical body. There's so many things that you can do to calm the physical body, but it takes habits. So like I said, even little micro habits throughout the day, every day, can really help you. So I hope you learned something from this video, and I hope it inspires you to work on your health. We are responsible for taking care of ourselves, and seek some help. Go on YouTube, find channels. There's tons of channels, even on somatic experiencing, where they teach you right there in their videos how to do slow body movements that help calm that nervous system. There's so much out there, and it's free. It's awesome. Therapy, I understand, can be expensive, and it's not affordable for everyone. So again, I hope you learned from this video, and if you liked the video, subscribe, and you'll hear many more videos from me. Have a great day.